If you've tried freezing, acid treatments, or even surgery for your plantar warts, but they keep coming back, you're not alone. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After treating thousands of patients with stubborn plantar warts, I've discovered why traditional treatments often fail. They don't activate your immune system to fight the virus. That's why I'm excited to introduce a revolutionary new treatment we're now offering in our office called the No Wonder Plantar Wart Kit. In today's video, I'm going to explain exactly why your warts keep returning, how this innovative nitric oxide therapy works differently than anything you've tried before, and why it might be the breakthrough you've been looking for. You'll learn the science behind why warts occur, how this pain-free treatment activates your body's natural defenses, and what you can expect if you're considering this advanced therapy. Before we get started, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others with stubborn plantar warts find this crucial information, and I post new videos every week with important foot health content. Most people think plantar warts are just a cosmetic issue, but here's what they don't realize. These warts are actually caused by a virus, specifically the human papillomavirus or HPV. This virus embeds itself deep in your skin and can be incredibly stubborn to eliminate. What's even more frustrating is that traditional treatments often miss the real problem entirely. The reason your plantar warts keep coming back isn't because the treatments don't work, it's because they're not addressing the root cause. Most conventional treatments focus on destroying the wart tissue, but they don't activate your immune system to fight the underlying viral infection. Think of it this way. If you have weeds in your garden, you can keep cutting them down, but unless you kill the roots, they'll keep growing back. Traditional wart treatments are like cutting the weeds. They remove what you can see, but the virus remains hidden beneath your skin, ready to create new warts. Liquid nitrogen freezing, also called cryotherapy, is probably the most common treatment you've encountered. While this can be effective for some people, it has significant limitations. The freezing destroys the wart tissue, but it doesn't necessarily eliminate the virus. Plus, it's painful. It can cause scarring and often requires multiple treatments and has no guarantee of success. Acid treatments, whether applied by a doctor or used at home, work by chemically burning away the wart tissue. Again, this addresses the symptom, but not the cause. The acid also damages healthy skin around the wart, which can lead to painful wounds that can take weeks to heal. Surgical removal might seem like the most definitive approach, but even cutting out the entire wart doesn't guarantee the virus won't return. Surgery also carries the risk of scarring, infection, and prolonged healing time. Many of my patients have had surgery only to see new warts appear in the same location months later. So why do these traditional treatments fail so often? The answer lies in understanding how your immune system works. Your immune system is designed to recognize and eliminate foreign invaders like viruses. However, the HPV virus that causes plantar warts is particularly clever at hiding from your immune system. The virus essentially cloaks itself, making it invisible to your body's natural defenses. This is why some people can have plantar warts for years without their immune system mounting an effective response. Traditional treatments don't change this fundamental problem. They don't wake up your immune system to fight the virus. In our practice, we've moved beyond these outdated approaches and now use two highly effective primary treatments: swift microwave therapy and topical Cantharidin. Both these treatments work by activating your immune system to fight the virus, which is why they're much more successful than traditional methods. Swift microwave therapy uses controlled microwave energy to heat the wart tissue. This heating process exposes the viral proteins to your immune system, essentially unmasking the virus so your body can recognize and attack it. The treatment only takes seconds and has an extremely high success rate with a very low recurrence. Cantharidin is a natural extract from a blood beetle that we apply topically to the wart. It causes the wart to blister and separate from the healthy skin while simultaneously triggering an immune response against the virus. This treatment is painless during application and highly effective for most patients. It does, however, carry some discomfort with it after the treatment in the first few days. Both Swift and Cantharidin represent fundamental shifts in how we approach plantar warts treatment. Instead of just destroying tissue, they work with your immune system to eliminate the underlying viral infection. However, even with these advanced treatments, we've discovered that we can enhance their effectiveness even further. This is where the No Wonder Plantar Wart Kit comes in. Rather than being a standalone treatment, the No Wonder Kit is designed to be used between your primary treatment sessions with either Swift or Cantharidin. This is how this combination approach works. After your Swift microwave treatment or your Cantharidin application, your immune system is already activated and working to fight the virus. The No Wonder Kit helps to maintain and amplify this immune response between your office visits. The key ingredient in the No Wonder Kit is nitric oxide, a naturally occurring molecule that plays a crucial role in immune system function. When you use the kit at home between treatments, the nitric oxide continues to stimulate your immune system, keeping it focused on eliminating the viral infection. Think of it like this: if Swift or Cantharidin is like starting a fire to fight the virus, the No Wonder Kit is like adding kindling to keep that fire burning strong between your office visits. This sustained immune activation dramatically improves treatment outcomes. The science behind nitric oxide therapy is fascinating. Nitric oxide is a signaling molecule that your body produces naturally. It plays important roles in blood vessel function, nerve communication, and immune system activation. When applied topically in the right concentration, it can enhance and prolong your immune response initiated by the primary treatment. What makes this combination approach particularly effective is that it addresses the main limitation of traditional wart treatments, the time gap between office visits. Previously, after Swift or Cantharidin treatment, patients would go home and wait weeks for their next appointment. During this time, the immune response could weaken, allowing the virus to potentially reestablish itself. With the No Wonder Kit, you're actively supporting your immune system's fight against the virus every few days between office visits. This sustained pressure on the virus significantly reduces the chances of reoccurrence and often speeds up the overall healing process. The treatment protocol is straightforward and can be done at home. The kit includes everything you need: a specially designed foot bath, nitric oxide generating sachets, and detailed instructions. You simply mix the sachets with water in the foot bath and soak your foot for the prescribed time, typically 2 to 3 times per week between your office treatments. One of the most significant advantages of this combination approach is that it treats the underlying viral infection comprehensively. While Swift or Cantharidin initiates the immune response, the No Wonder Kit helps to maintain it, ensuring that even microscopic viral particles that may escape the initial treatment are eliminated. What can you expect when using the No Wonder Kit between treatments? Most patients report no discomfort during the soaking sessions. Some notice a slight tingling sensation, which is actually a good sign nitric oxide is working. Unlike other treatments, there's no downtime. You can continue all your normal activity immediately after each session. The combination of Swift or Cantharidin with the No Wonder Kit typically results in faster healing time and significantly lowers recurrence rates compared to using either treatment alone. Most patients see complete resolution within 6 to 12 weeks, depending on the size and duration of their warts. For patients who've tried multiple treatments without success, this combination represents a genuine, comprehensive approach. Instead of repeatedly attacking the wart with destructive methods, you're working with your body's natural healing mechanisms, both in the office and at home. The No Wonder Kit is safe for most people, including children over 12. It doesn't contain harsh chemicals or acids that can damage healthy skin. The nitric oxide is generated naturally through chemical reaction and breaks down quickly, leaving no harmful residue. Cost considerations are important with any treatment. While adding the No Wonder Kit to your Swift or Cantharidin treatment does increase the overall cost, most patients find the improved success rate and reduced recurrence rate makes it a worthwhile investment. The faster healing times also mean fewer office visits overall. Insurance coverage varies, and since this is a relatively new adjunctive treatment, most insurance plans don't cover the No Wonder Kit. However, many patients find that their enhanced effectiveness makes it worthwhile even as an out-of-pocket expense. Who might not be a good candidate for this combination treatment? People with certain autoimmune conditions or those taking immunosuppressive medications should consult with their doctor before starting any treatment that stimulates immune function. Pregnant women should also check with their doctor before treatment. If you have diabetes or circulation problems, it's important to have any foot condition evaluated by your podiatrist. When the No Wonder Kit is gentle, Any foot problem in diabetic patients requires medical supervision throughout treatment. The convenience factor of having an at-home component to your treatment can't be overstated. Instead of relying solely on office visits, you're actively participating in your healing process at home. This gives many patients a sense of control and involvement in their recovery. If you're interested in our comprehensive approach using Swift or Cantharidin combined with the No Wonder Kit, we can evaluate your specific situation and recommend the best primary treatment for your case. We'll also provide proper instructions on using the No Wonder Kit to maximize your results. For those who have been dealing with stubborn plantar warts for months or years, this combination approach represents a genuine hope for a permanent solution. The synergy between professional treatment and at-home immune support creates the most comprehensive attack on the virus we've ever been able to offer. If you found this information helpful, please share this video on social media. Your simple share can help someone find relief from a problem they've been struggling with for years. Also, leave a comment below if you have a question about Swift or Cantharidin or the No Wonder Kit. I do my best to respond. If you're ready to try our comprehensive approach to treating your plantar warts, schedule an appointment to discuss whether Swift or Cantharidin combined with the No Wonder Kit might be right for you. The link to schedule is in the description below. Thanks so much for watching, and have a great day.